3 a.m. You wake up with this crushing weight on your chest. It feels like someone's sitting on you. Your left arm tingles. You're sweating bullets. This is it, right? This is the big one. Heart attack. So you rush to the ER. They hook you up to every machine they've got. ECG, blood work, chest x-ray, the whole 9 yards. And then, the doctor walks in with your results. Everything looks normal. Your heart's fine. But here's the thing that's absolutely messing with your head. If your heart's fine, then why the hell does your chest still hurt? Why does it feel like you're dying? I'm about to show you the real answer, and it's gonna blow your mind. Look, I get it. You're scared out of your mind right now. You've probably Googled chest pain about 50 times this week. You're reading horror stories on Reddit. You're convinced WebMD just diagnosed you with everything from a heart attack to some rare disease you can't even pronounce. Here's what nobody's telling you. Over 12 million Americans go to the ER every single year with chest pain. 12 million. And you know what? Nearly 70% of them? Their hearts are totally fine, completely normal. So if it's not your heart, what the heck is it? And more importantly, why won't anyone give you a straight answer? Stay with me for the next 9 minutes, because I'm gonna break down exactly what's happening in your body, why your chest hurts, and what you need to do about it right now. Here's the deal. Your chest isn't just your heart. I know that sounds obvious, but think about it. Your chest has muscles, ribs, nerves, your esophagus, your lungs, and yeah, your heart, all packed into one area. When something hurts in your chest, your brain freaks out and immediately thinks, heart problem, because evolutionarily, that made sense. Better safe than sorry, right? But here's where it gets wild. Your brain can't always tell the difference between heart pain and pain from everything else in your chest. It's all sending signals through the same nerve pathways. It's like if every room in your house had the same fire alarm. The alarm goes off, but you have no clue which room the fire's in. Is it the kitchen? The bedroom? The garage? You just know something's wrong. That's what's happening in your chest right now. Something's setting off the alarm. Your tests came back normal because your heart isn't the room with the fire, but the alarm's still blaring, and you're still feeling the pain. Now, before we dive into what's actually causing your pain, you need to understand something critical. And I mean this. If you're having chest pain right now, especially if it's new, getting worse, or you've got other symptoms like shortness of breath, dizziness, or pain radiating to your jaw or arm, stop watching this video and call 911. Seriously, I'll still be here when you get back. But if your doctor's already cleared you, if they've run the tests and told you your heart's good, then what I'm about to tell you is gonna change everything. Alright, let's get into the actual reasons your chest hurts. I'm gonna break this down into 5 main culprits, and I guarantee at least one of these is what's going on with you. Culprit number 1, costochondritis and muscle strain. This is the most common non-heart chest pain, and most doctors barely mention it. Costochondritis. It's inflammation where your ribs connect to your breastbone. That little piece of cartilage gets irritated, and boom, feels like you're having a heart attack. How'd you get it? Maybe you went hard at the gym after not working out for months. Maybe you've been hunched over your laptop for 12 hours a day. Maybe you slept weird. Maybe you coughed really hard for a week straight. Here's the test. Press on your chest with your fingers. If the pain gets worse when you push on it, or when you twist your body, or take a deep breath, that's probably costochondritis. Your heart doesn't hurt more when you poke it, but inflamed cartilage definitely does. Culprit number 2, anxiety and panic attacks. Oh man, this one's brutal, because it creates this vicious cycle. You feel chest tightness. You think it's your heart. You panic. The panic makes the chest tightness worse, which makes you panic more, and round you go. When you're anxious or having a panic attack, your body dumps adrenaline into your system. Your chest muscles tighten up. You start breathing fast and shallow, which makes your chest hurt even more. Your heart rate spikes. Everything feels like a heart attack. Studies show that up to 25% of ER visits for chest pain are actually panic attacks. 25%. That's 1 in 4 people convinced they're dying, and it's anxiety. Here's the kicker. Anxiety chest pain is real pain. It's not all in your head. Your muscles are actually tight. Your chest actually hurts. But the cause isn't your heart. It's your nervous system going haywire. And get this, once you know it's anxiety, the pain often gets better just from knowing, because you stop adding panic on top of panic. Culprit number 3, GERD and acid reflux. This one's sneaky as hell. Your esophagus runs right next to your heart. When stomach acid comes up and irritates your esophagus, it can feel exactly like a heart attack. Burning chest pain, pressure, tightness, the whole deal. Millions of Americans deal with this every single day and have no idea. They think it's their heart. Nope, it's pizza at 11 p.m. Classic signs: it's acid reflux. Pain gets worse when you lie down. Gets worse after eating, especially spicy or fatty foods. You might taste something sour in your mouth. You might have a burning sensation in your throat. Here's the dead giveaway. If an antacid makes it better within 20 minutes, it's not your heart, it's reflux. Culprit number 4, pleurisy and lung issues. Your lungs have this thin membrane around them called the pleura. When it gets inflamed, usually from an infection or virus, every breath feels like someone's stabbing you in the chest. The telltale sign? Sharp pain when you breathe in deep. You want to take shallow breaths because deep ones hurt too much. You might have a cough. You might feel a bit short of breath. This one's important to catch because sometimes pleurisy can be a sign of pneumonia or other lung infections that need treatment. But again, it's not your heart, it's your lungs. Culprit number 5, nerve pain and referred pain. This one's gonna sound weird, but stick with me. Sometimes a pinched nerve in your neck or upper back can cause chest pain. Yeah, really. Your nerves don't always cooperate with what makes logical sense. A nerve getting squeezed in your spine can send pain signals to your chest. It's called referred pain. Also common, people who sit at desks all day with terrible posture. Your upper back gets tight, your shoulder blades don't move right, and suddenly you've got this weird aching in your chest that comes and goes. A lot of times, physical therapy or chiropractic care can fix this one, but it takes weeks to figure out because nobody thinks back problem when their chest hurts. So there you have it, 5 major reasons your chest hurts even though your heart's totally fine. Costochondritis, anxiety, acid reflux, lung inflammation, nerve issues. But knowing what it is, that's only half the battle. Now let me show you exactly what to do about it. Alright, you've got chest pain, your heart tests are normal, and you're pretty sure it's one of these 5 things. Here's your game plan. Step 1. Document everything. Stop trusting your memory. Start writing this stuff down. When does the pain happen? What makes it better? What makes it worse? How long does it last? What does it feel like? Pressure? Sharp? Burning? Aching? This isn't just helpful for you. When you go back to your doctor with a detailed log, instead of "I don't know, it just hurts sometimes," you're gonna get way better help. Step 2. Try the specific fixes. If you think it's costochondritis, anti-inflammatory meds like ibuprofen can help. Ice the area for 15 minutes at a time. Avoid movements that make it worse. If you think it's anxiety, learn some breathing techniques. Box breathing works great. Breathe in for 4 counts, hold for 4, out for 4, hold for 4. Repeat. This literally tells your nervous system to chill out. If you think it's acid reflux, cut out the late night eating. Smaller meals, less spicy food. Sleep with your head elevated. Over-the-counter antacids can help short-term, but if you're popping them every day, you need to see a gastroenterologist. If you think it's muscle or nerve-related, gentle stretching can help. Yoga, physical therapy, better posture. And seriously, get up from your desk every hour. Step 3. Get the right follow-up. Here's what most people miss. Your ER doc cleared your heart. Awesome. But that doesn't mean you're done. You need to see the right specialist based on what you think it is. Persistent muscle pain? See a physical medicine doctor or physical therapist. Anxiety that won't quit? Time to talk to a therapist or psychiatrist. There's zero shame in this. Your mental health is just as important as your physical health. Acid reflux that's not getting better with over-the-counter stuff? Gastroenterologist. They can do an endoscopy, figure out exactly what's going on, and get you proper treatment. Breathing issues or lung-related pain? Pulmonologist. Posture and nerve stuff? Physical therapist, chiropractor, or an orthopedist. The point is this: your primary care doctor is great, but they can't be an expert in everything. Once you know the general area of the problem, get someone who specializes in that specific thing. Real talk for a second. I know how scary this is. I know you've probably spent hours lying awake at night, convinced something's seriously wrong. I know you've canceled plans because you didn't want to be far from a hospital. I know you've typed chest pain into Google so many times your autocomplete probably has it memorized. But here's the truth. You're not crazy. Your pain is real. And the fact that your heart is healthy, that's actually really good news. Because the other stuff, the muscle pain, The anxiety, the reflux, we can fix that. Here's what to expect going forward. Weeks 1 through 2. Start tracking your symptoms. Try the basic interventions for whatever you think it is. Weeks 3 through 4. If things aren't improving, make appointments with the appropriate specialists. Don't wait months. Get on it. Months 2 through 3. This is usually when you'll start seeing real improvement once you've got the right treatment plan. Most people dealing with non-cardiac chest pain see significant improvement within 3 months once they're on the right track. You've got this. Your heart's good. That's huge. Now it's time to figure out what the actual problem is and fix it. If this helped you, smash that subscribe button. Drop a comment telling me which of these 5 you think is causing your chest pain. Next video, I'm breaking down the exact anxiety techniques that work when you're having a panic attack. You're not going to want to miss it. Remember, you're not alone in this. Millions of people go through the exact same thing, and they get better. You will too.